Hello, myself Dr. Yogesh Kalyanpad. I am MBBS MD, specialist in dermatology, and I finished my graduation and post-graduation from KM Hospital, Parel, Mumbai. So today we are going to discuss about the fungal infection, and that's called as also tinea and ringworms in layman language. So we have some questionnaires and I'll go through that and I'll try to guide you in details about the fungal infection and the measures to prevent them. So tinea is superficial skin infection which can affect your skin as well as nail and hairs, and depends on which part has been involved. It's named in various ways. The types of the tinea are named according to the sites and the involved area. So it can be tinea manum, which involves your palms. So once the palms are involved, that's called as tinea manum. If it's involving your soles, then it's called as tinea pedis. If it's involving your legs and its groins, then tinea cruris or the jockey itch. If it is involving your body, then it's a tinea corporis. If it is involving your hairs, then it is tinea capitis. So for this question, the answer is strictly no, because you cannot buy any over-the-counter medicines to treat the fungal infection. So the fungal infection, as I said, it can be of various types, and depends on the type that your treatment duration, medications, everything differs. Plus depends on your body weight, depends on your chronicity, and depends on your other physical conditions. We need to adjust the dosage of the medicines and the creams. So never buy any over-the-counter medicines, as it can contain the steroid, and the steroids over a period of time can increase your fungal infection and it causes resistance for the treatment as well. So if you buy any over-the-counter medicines, it will not only affect your health, but it will also prolong the treatment duration. So any moisturizing effect can decrease the itching sensation for a while, but these kind of medications, like if you are trying to apply anything, home-based medications or any moisturizing, or like there will be a lot of videos around you or the Google suggestions that can try to push you to use various products which will be easily available over the counter, that can in fact increase the tinea by occlusive action as well. So rather avoid using any oils on the tinea. Different types of the tinea are there, so you can easily get it on the body. So the tinea is mainly because of the wetness or the dampness or the humidity. So more you sweat, it starts with your groin area where you start sweating, or if you are wearing a socks for a lengthy day, then it starts from your leg. So it can start where the wetness is there for a prolonged period of time. If you are sweating a lot, you should bath twice, or you are working out, then you should go home and take a bath. So all these things, if you are not taking care properly, then the dampness will definitely give you the fungus, which is the tinea. No, these are the perceptions from the people that it gets worse initially, then gets better. No, like if you are applying any strong chemical, like there are so many products, over-the-counter products, or there are so many advertisements which shows that you apply something that burns your skin, and that means like you're worsening the tinea and then it's better. No. So if you're applying any over-the-counter medications or any medication which is trying to burn your fungus, it is actually irritating your skin and trying to get rid of the fungal infection from the superficial layer, which is not a curative one. It will damage your skin, plus it will cause regrowth of the tinea once the skin layer forms again. So you need to take a proper course medications so that it gets out from your body. Yes, so tinea from the body, you need to take medications. The medication will definitely take care of the tinea, the oral medication as well as the topical medications, plus there are few soaps, then body washes are available that also need to take care. Plus you need to buy some dusting powder if the area is getting sweaty or the dampness is there. And the second thing, once you kill the fungus from your body, it can stay in your clothes, and that clothes can harbor this fungal infection and that can give it back to you. Apart from the medication, what else kills the tinea or the fungal infection is the heat. So you need to soak all of your clothes in a hot water, keep them soaked for 1 hour or two, then wash them, and try to wash all your affected clothes separately, not to mix with the any other person's clothes or your other clothes which are not been soiled with the fungal infection. Then you need to iron them. So just washing with the hot water won't be suffice. You need to iron them, like everybody irons their outside clothes because it makes you look fresh, but you should iron the inside clothes as well. Ironing the inside clothes will take care of the fungal infection from your inner wears as well. Starts from the damp area, it is a contagious thing as well. So if somebody is having this thing, if you are using some clothes or if you are using some towel who has been soiled with like other person's infection, then it starts there. Plus, as I said, like damp areas, like the sweaty areas in the jockey, as the jockey starts from your groin areas, or it can start from your leg as well because of the sweaty socks. So the ringworm starts because of the dampness or the contagious thing, like from one person to the other person. So incognito is a scientific term. Incognito means you can't recognize it. So doctors cannot recognize it in a very specific way, like the tinea looks very clearly in a round circle, round fashions, and sometimes there will be a lot of scaling on top of it. But once you use the steroid cream, that changes its morphology. It's not recognizable. That's why it's incognito. The name itself suggests that tinea incognito is not recognizable, and it happens most commonly because of the steroid medications, and that are mainly available over the counter. There are so many companies that try to churn out the profit by selling these steroid combination creams, which are small antifungal creams as well. But you should never use any steroidal cream, and always take doctor's advice. I say specialist advice, the dermatologist advice to cure your tinea. So as long as you are not taking the treatment, it is contagious. Like once you start the treatment as well, it takes time to get it non-infective. Like once you stop seeing any scales, once you stop seeing that redness, then it renders non-infectious. No, there is no direct correlation with the stress and the ringworms. The ringworms can spread very fast, so people can correlate with various things. Soak your clothes in a very hot water to get rid of that from your clothes, but don't use very hot water for your bathing, and that can like damage your skin. So no need to take very hot water bath for the clearance of the tinea. You just start with the medications. Ringworm is only limited to your skin, sometimes nail and the hair, so it will never enter your body, your system, so it won't stay with you for lifetime. We can clear it easily, and it can come back to you again, because as I said, like there are multiple factors. One is the dampness, the sweatiness, and your clothes. All these are the sources. Or anyone is having the fungal infection, like somebody is at a home is having fungal infection, he can definitely transfer that infection to you. So it can come back to you again, but with the medication it completely goes out from your skin, hair and nail once you get the treatment, and the chances are there it can come back to you, so it won't stay with you forever. We also hope for that, but it doesn't. So tinea definitely requires the treatment. So Tinea versicolor is the mildest form, and here it's not the same organism, the dermatophytes causing the versicolor here. It is caused by Pityrosporum organism, which is a very normal commensal on your scalp. Means that can cause dandruff in you, and this the same way it causes like multiple small white patches on your upper trunk. Sometimes it can be dark, sometimes it can be pinkish. That's why the name versicolor. So the normal commensal also can cause this, and contagious thing, like from one person to other person also it can spread. So tinea, the other name is ringworm. So the ringworm means like it's ring shaped. Anything which is red, thick, scaly, circles, it can be tinea. Treat the ringworm from your clothes and your surroundings, but from your body in very initial stages it might get better with the precautions like keeping the area dry, using fresh clothes, like drying out all your clothes and keeping that area completely dry, but no other natural ways to cure it. The medications are definitely designed to get rid of them from your skin, so definitely approach nearby dermatologist and get rid of them. The personal hygiene is very important, so you have to keep cleaning yourself, take bath regularly. If you are sweaty and if you feel that few of the areas are wet, you need to dry them, and that personal hygiene is the utmost important in this thing. Then second thing, you need to avoid scratching. Like sometimes you scratch, it can go through your nail to the other places, so try to avoid scratching. If you're feeling very itchy, then what you can do is you can take a small tissue paper, rub it, or you can take a napkin, then rub it and then throw it either, or you can keep it for the washing. The other thing is the medications. So medication is very important. You have to complete the course given by the dermatologist. So the course can vary from person to person. It can be 15 days, it can be a month, sometimes it can go up to the 2 months as well. So the course is very important. If you feel like you might feel within a 10 days or something, the fungal infection almost get cleared from your body. The moment you stop, it can come back to you, because the fungal infection stays in various layers of the skin. The upper layer, if you feel that's cleared, that doesn't mean it's cleared from your other layers of the skin. So the course is very important for this fungal infection thing. Then how to apply the cream. So you have to apply cream gently rub it, and try to apply the cream not only on the circle what you can see, but 1 to 2 centimeters beyond the circles. Soak your clothes in a hot water, like keep it for 1 hour or 2, then wash it properly. Try to wear loose clothes, try to avoid tight clothing. Like if you're wearing jeans which are very tight, if you're wearing any clothing that is very tight, that hampers the aeration, that hampers the drying out of your skin. These are the ideal places where the fungal infection can grow. So try to wear some loose clothes, like if you're wearing some underwear which is very tight with the elastic bands, try to shift to the boxers, and that will definitely help. So even the footwears. So if you are in office goer, then you have to use shoes for a long time. Then try to buy some shoes which has some aeration system in it. Never share your towels, bed sheets, soaps with anyone. Like if anyone is having that thing, that will definitely comes to you. Or if you are having this fungal infection, it will transmit to the other persons from you. Then as I said, like you have to dry out all the clothes. Clothes should be dried inside out, preferably in the sunlight, plus iron them. So ironing not only the outside clothes, plus the inside clothes also helps. If you keep the tinea left untreated, it can spread from one place to the other places. It can affect your most of the body parts, and like we have seen few of the patient, 90% of the body it is covered with the fungal infection. If it's very early, it's a small patch, it's a single lesion what you got, and you go to doctor, it gets better within week or 2 with the medications. But it's involving a lot of body area, like more than few patches, like more than 5 to 10 patches, it takes time. So it's earlier the better, smaller the better. So whenever you feel, consult a dermatologist and get it treated. There are some studies that indicates that if you are using antifungal soaps, antifungal body wash, that clears the fungal infection from your body faster, plus it helps for the prevention of the recurrence as well. So there are a lot of antifungal soaps available. I won't take name of the brand. Alcohol, there are different concentrations, like the higher concentration of the alcohol acts as a sterilizer. So what we use as a sterilium is a isopropyl alcohol, which is stronger concentration. It clears the bacteria from your skin. So it won't clear your ringworm infection, because it's not only on your superficial skin layer, so it has some roots deep down, so it won't clear your fungal infection. So definitely see a dermatologist, qualified person who is treating fungal infection very often. And as soon as you have any signs or symptoms, or you feel itchy patches there or itching is there, see a doctor. Like sooner is better for this thing. Hope you got all the information needed to clear your fungal infection, and the doubts regarding the overuse counter medications and home-based remedies.